taking the doctor's word that, he will grow.
Less than 2 months after the visit, Alex starts walking. The Salems breathe a sigh of relief until they notice how he's walking.
He just wasn't as sturdy of a child. His legs and arms and stuff didn't give him as much security.
He was working to stay balanced, working to not fall. Alex never developed that ability to feel stable, and he was very clunky, almost like a Frankenstein walk.
Then, shortly before his second birthday, Alex develops an ear infection that knocks him literally off his feet.
He could hardly stand up. He'd stand up and fall over. I mean, he was like a noodle. That's when the pediatrician said to me that based on the fact that we'd had these walking issues, coupled with an ear infection that's gotten him off balance, he wanted us to go to a neurologist.
Scared of what the balance problems might mean, Jane and Ed take Alex to see a neurologist.
He looked at him, bent him around, felt his joints. He said, yeah, he is pretty loose.
But as he continues with the examination, he discovers something bizarre.
When he took the little reflex hammer and knocked on his knees and his elbows, he got no reflexes from Alex at all.
The neurologist performs a test called an electromyogram to see if the electrical impulses in Alex's muscles are working properly by stimulating them with a low electrical current.
He had electrodes or something hooked up to him. It was electric shocks, little zaps into his skin. And I remember just having a box of Kleenex next to me and just wiping tears away. It was heart-wrenching.
The results of the EMG are perplexing. 2-year-old Alex has peripheral nerve damage in his arms and legs. Like static on a telephone line, peripheral nerve damage distorts and in some cases interrupts communication between the brain and the rest of the body. It could be an indication of injury, infection, or worse. The neurologist immediately orders an MRI of Alex's brain.
I was most fearful that there was something wrong with his brain, a tumor, some kind of brain surgery that would have to happen.
To everyone's relief, the MRI comes back clean. Alex's brain looks completely normal. But an otherwise healthy 2-year-old shouldn't have peripheral nerve damage.
There had to be some underlying cause that he wanted to uncover.
The neurologist sends Alex home and arranges for more testing. But before any more tests can be done, Alex develops another sinus infection, the worst one yet.
Alex was put on an antibiotic. He was acting very sick, just kind of lethargic.
His breathing was very bad. He looked very sickly. He had no energy.
But this time around, the antibiotics are not helping. Within a day, Alex can barely move, and his breathing is labored.
His breathing was horrible. I was really, really frightened. I felt like he could stop breathing any moment.
Ed and Jane rush Alex to the ER.
I was holding Alex. I was trying to calm him. I wanted to be able to hold him tight, calm him, give him CPR if I needed to.
He clearly didn't have much energy. He was sleeping and difficult to arouse. When you did tests on him, for instance, to check the reflexes, his legs didn't move. We noted he was breathing quickly.
Alex is hooked up to a glucose drip, and blood tests are ordered. When the tests come back, they reveal Alex's lactic acid levels are much too high. Lactic acid is an alternate energy source created by the metabolism in times of extreme exertion. Athletes experience high levels after competition, and it's the chemical that makes muscles ache after exercise. The body can run on lactic acid for short intervals, but over an extended period of time, the lack of a proper energy source can be disastrous to the brain.
We don't know why he has the excess acid in his body. The longer that excess acid is there, the more concerned we are that it's going to lead to damage. Basically, from the time he came in, we're racing against time.
2-year-old Alex Salem is fighting for his life. He came into the ER just a few hours ago with what seemed like a bad sinus infection. But now doctors have discovered that the lactic acid in his body is at toxic levels, and they need to figure out why fast.
He was breathing deep and short.
Things were getting really bad for Alex. If his body keeps building up this lactic acid, this is not going to be good for the brain.
One possible cause for Alex's high lactic acid is lack of oxygen.
If oxygen doesn't go to your tissue, the tissue says, I need more energy, and the way it makes more energy is it takes sugar and converts it into lactic acid.
Alex is transferred to the pediatric intensive care unit. He is intubated and hooked up to a respirator so the doctors can regulate his oxygen intake.
We had many different doctors that came in, lung specialists, kidney specialists, eye doctors, heart people.
We had all kinds of tubes in him, and we were just praying that it would be ours forever.
If the high lactic acid is being caused by a shortage of oxygen, 24 hours on the respirator should solve it. But when the doctors check him the next day, they see that Alex's lactic acid is still climbing.
I said, this doesn't make sense. There have to be other explanations. Is it possible that he has some sort of an internal problem in his body?
Dr. Wisnitzer begins to wonder if Alex's metabolism could be malfunctioning.
When we're processing sugar correctly, there's a whole little small factory that helps break down sugar into its elemental parts. There's different workers within that factory. And if the worker didn't show up, the assembly line falls apart.